My name is Dr. Jonathan Ho. I'm a GP working in Wagga Wagga. I'm very passionate about helping people through trauma, through the justice system, mental health, drug and alcohol. But I guess my other passion when I'm not working is tailoring. So I love making all my own clothes by hand. Yeah, I'm wearing something that I made today. For me, trauma-informed practice is really about safety. So having a safe environment for the patient. It could be just very little things, engaging, making sure that they're comfortable. Listening, of course, is one big thing, but showing collaboration, that you're not here to tell them what to do or tell them how they feel, but really it's about offering to see whether we can work together. And I think if you have the groundwork of safe environment and safe relationship, it could actually be conducive for them to have safe emotions. And part of the safe emotions could be that they'll tell you what's really going on inside them, what symptoms they're getting, how they're really feeling about things. And how good is that? You get a privilege to understand them a little bit better, and often I will thank them for that. Thank you for letting me understand you a little bit better. Sometimes there might not be anything I can do immediately, but at least we're walking that little part together on that journey of recovery. Thinking about mental health and the people on that journey of recovery, not all of them might be able to drive or have a car. Sometimes, depending on the circumstance, a home visitation might be appropriate. Having that flexibility as a GP can really help a patient out.
He actually listens, but more than that, I think if you could clone something, it would be those empathy skills and understanding that they might be the expert in things they've learnt, but they're not the expert in the patient. So learning to walk in the patient's shoes and really listen.
It makes you feel comfortable, but at the same time it's warm and it's inviting. It's one of those guys that you can just open your heart to, because he knows that he'll do the same for you. If you're honest with him, he's honest with you.
Dr. Ho has a really holistic approach to his practice. He doesn't see you as another patient number. He sees all of you and invests in the person that you are. It makes the world of difference. The fact that Jonathan chooses to proudly wear the rainbow flag and the trans flag openly in somewhere like Wagga is still a really big deal, and it's not at all tokenistic.
The key thing is patient-centered care, not service-driven care. And the only way that I can do that in Wagga Wagga is actually infiltrate every service I can possibly do, so that we minimise the service drive, but actually focus on the patient. I think if you have patient-centered care, it does increase engagement, simply because there's a buy-in. There's a reason for them to engage, or they understand their care, and so that they know what they're engaging in. In my office, I actually have a didgeridoo, and that didgeridoo was addressed to me, but they used the word clever man. And the way that I interpret clever man is, I came to Australia and I'm living on the best lands. I've taken the best resources so that I can study medicine. And I want to give that back to you, the very best that I have, back to you.